All right, so we are starting an IV for IV major autoheme and thought you guys might be interested in seeing the process. So we are going to get started. We have a vein finder here, so you can see the veins under the light.
Look at that. Bam. Boom.
Beautiful.
Dun, dun, dun.
So the nice thing is once the catheter is in, it's usually really comfortable. People can move around. So she's just taping that tubing down so it doesn't put any pressure on where the catheter is in. And then the patient can do work or be on their phone or whatever. We just flushed with some saline just to make sure we have a nice clean line. And then we do a little flush with heparin just to make sure, since this is going to be a longer procedure involving a lot of blood. And I also have a clotting issue. And a side note, heparin is an excellent allergy treatment. I learned this from some of the older allergists.
Okay, so we have started the saline drip. She will receive about 400 mils of saline prior to her IV, which helps a lot with tolerance to the IV as well.
All right, so we just put a bunch of saline in me, and now
we are going to add heparin, half of our heparin dose. The first half of the heparin dose was flushed into her veins when we inserted the IV. The second half is going to go into the IV bag so that when the blood runs in, we make sure that the blood doesn't clot inside the IV bag. When blood is outside of our body, it's not moving and it is not at body temperature. It likes to clot extra. Okay, so our next step is that we have now placed the heparinized saline below the patient's arm level so that blood will flow into the bag. So we will open up this clamp. And now the blood is running out of the vein. It'll go through that cuvette that we'll talk about later and into this IV bag. We're gonna fill about 200 milliliters of blood into the IV bag.
and scene.